Hi there, Dr. Sadi Erfani here, plastic surgeon with Spearlift Aesthetic Plastic Surgery, welcoming you to our discussion today about fat grafting. We're lucky today to have one of our best patients here who has been willing to share her images from before and after her fat graft procedure, and now we get to demonstrate to you the actual power of this incredible procedure. Many people already understand the utility and value of having a volume augmentation to their face. A lot of people understand this after having gotten maybe some Restylane or some Juvederm. Well, there's a great alternative, and we all know about this now, which is your own fat. Most of us have fat in an unwanted supply and are able to use a small amount of it to recreate the foundations of beauty on the face, to augment the areas where volume normally looks youthful. And as we'll see with the patient that we're going to examine and the changes, the exceptional changes that she witnessed from before and after her procedure, this is a wonderful, wonderful procedure to consider doing, and we'd love to educate you about it. So thanks for joining us here today.
Here we have one of our beautiful patients, our 75-year-old woman who had initially presented to me with complaints of some bulging under the eyes and also some irregular configuration of her cheek, where she had noticed a deepening of a line, as you can see as I'm pointing out in the pictures, across her cheek, and as well as some lines under the corners of the mouth. Now, for her, we mentioned the benefits of fat grafting instead of doing a lower eyelid procedure. Many times in the past, I would have considered doing a lower eyelid procedure to reduce some of the bulging of the fat under the eyelid. However, this fat serves a function, and she did not really require a removal or reduction of this fat as much as she required a replacement of fat in the area that was defining it, which is this underlying bony structure, which has lost all its layer of fat that used to be abutting this area and making it much more smooth. In addition, the fat that used to be filling this area in her cheek, which has created this visible line, has also diminished and metabolized over time. So a fat graft was recommended, and of course the fat was going to be harvested from another part of her body where she didn't necessarily want to have the fat there, and this fat was then harvested and placed into these areas deficient of fat along her temples, along her eyes, certainly in her cheeks, along the corners of the mouth. And you can see in the next picture the results of this procedure. We're able to reproduce the nice youthful fullness of her cheeks, able to completely soften under her eyes and give her a more softened contour and more augmented and filled contour in those areas that really brought out a youthful configuration. This is a 75-year-old woman. She looks extremely youthful, and it's because of the natural fat that she had in her own body was placed in strategic places on her face. And you can see on the side view where she used to have this line, this deflated line cutting across her cheek, that's now completely filled in and now very smooth and soft. She has beautiful configuration on both her cheeks. We reduced some of the nasolabial grooves as well as completely eliminated some of the lines around her mouth from doing the fat grafting procedure. Thank you.
Is this something that can help you or maybe someone you know? Come and see us for your free evaluation. We can't wait to wow you.